Hey guys, Nick Harowski here with Robbins Rehabilitation. And today you're here for the Medicare Maintenance Workshop. So what is Medicare Maintenance? I'm going to kind of just dive into things here, right? So Medicare Maintenance is skilled physical therapy for patients who just need more PT. And I mean that because there used to be a big thing of patients were not able to do what was considered maintenance therapy in physical therapy, right? If you weren't making progress, you were basically just kicked out. But that is no longer the case because Medicare, there's been a court ruling back to, I believe it was 2013. So there's no longer that need to make the continual progress. Now it is actually okay for maintaining a current level, as the name implies, preventing setbacks, or it's actually okay if somebody is regressing. If you are coming to PT and your balance or your strength is still just getting a little bit worse, a little bit worse, uh, but it's still not not dropping as fast as it would if you weren't doing PT. The Medicare recognizes this actually as a good thing, and I agree with them. Right? It's important for all individuals to have that ability to really just keep that balance, keep that strength and confidence, right, that comes with it. And then it really helps to avoid major injuries, right? When we talk of falls being really just a high predictor of mortality, right, within 1 year after a major fall, especially if it requires hospitalization, like those kinds of things aren't good. And thankfully, Medicare did realize this and they kind of got on board with, yeah, okay, let's get the patients the care that they need to maybe not start running up and down flights of stairs or being out playing soccer with their grandkids or something like that. And maybe you can get to that point. I don't want to discourage that either. And sometimes it's just good to be able to maintain the ability to walk up and down stairs with support from one arm or something like that. So that's really what Medicare maintenance is still, it's physical therapy just under a different name, right? So it doesn't have to be that it's anything else special beyond that. That's really just the biggest distinction there. So some of the questions that often come up, right? So what about my cap, right? So the Medicare cap is no longer as of 2018. However, there is still well, I'm going to just give the most recent number. I didn't look to see when this is changing. It usually changes every year by $10, by $100. But right now there's a threshold at $2,410. So at which point, uh, we as clinicians need to provide a letter of medical necessity. So this isn't anything that you, on your part, you would have to worry about, right? This is something, hey, we're going to type it up, sign it, keep it in the chart in case Medicare ever says, hey, why are they still coming to PT, right? And that's really something that's pretty easy to do. But the justification should always be done. So I don't care whether somebody's coming in for regular physical therapy, for maintenance physical therapy, a clinician should always be able to justify that treatment. That's just really important to be able to do. And I'm sure like whoever you've been seeing, right, has been able to justify or you wouldn't still be attending. But oftentimes there are many things that can be done to properly justify therapy and then just document why it's necessary still. So one of the questions that came in before we were talking about doing this was, does Medicare stop covering? So this kind of is just a reiteration of that, but the answer to that is simple no, right? Now, what do you need for that, right? There's really, I usually say three people involved with that. There's number one, the patient, right? Number two, physical therapist, and number three, the patient's physician, right? So all three kind of work as a team to see what is best for that individual, right? So you, the individual, what's best for you, right? If you're saying, you know what, I don't feel that steady on my feet, I want to feel more comfortable with that. Maybe you've had falls in the past. Maybe uh, you just can't walk around the store that you want to be able to do. So I'm saying simple things, but it can be much more involved than that, right? Like if you want to still get out and do some hiking, travel, like walk through the airport, um, go play again. I always kind of come back with like doing stuff with the grandkids, the family, because that's such an important thing to so many people. So it's if you feel that you still want that, right? If the physical therapist feels that they can help you out either progressing that, maintaining that, or just trying to make sure that you're not making any setbacks, uh, most of the time the physician says, "Hey, like keep it up." They want you to do it because they're in like they have your best interests at heart too. Like they want you to do well. So as long as all of those are in agreement, it's easy to justify. Like I said, we just have to make sure that we're documenting it properly. And then Medicare is generally on board with that because they want to avoid any other major injuries because again, major injuries cost a whole lot more money to Medicare. That's really probably their biggest thing. Like, of course, I want to hope that they do have everybody's best interest at heart and really hope they care for the patient, right? The individual. It may not always happen. Regardless, they still want to save money then too, right? So how do they save the money? Well, they send you to physical therapy because even coming 2, 3 times a week for physical therapy for years on end is going to be cheaper than any surgeries, injuries, anything like that. Okay, so who not before not so much who but like what type of diagnoses are often seen covered so you're going to get a list of these two and I'm going to go over a couple of them with you and this is by no means an all-encompassing list uh really there's no there are no specific diagnoses that this must be however any form of arthritis osteoarthritis rheumatoid arthritis they're all going to be very easy to justify care for. Any type of degeneration of joints, whether that be in the spine, whether that be in the extremities, so the spine, the neck, right? Like any of that, hips, knees, ankles, like the head, shoulders, knees, and toes, like the song goes, right? Any of that works. And any other real things like any disc injuries, any stenosis of the spine, really anything going on with the spine is very common to see. One that we very much see is any problems, difficulties with walking or balance or falls issues, right? Those are big red flags for a lot of physicians too. They understand the importance of not having people fall, right? Uh, Falls, especially as we age, can be more and more damaging. So really trying to protect against any of that. And that's also why like any dizziness, any vertigo type symptoms, any and all of that, right, might be really included in this because again, that goes hand in hand with some of that balance issues, fall issues. They might be separate. Sometimes it's a weakness issue, sometimes it's sensation issues. So just with the feet, so diabetes is a very common condition that we'll work with people. But anytime just general weakness, right? If you're just saying like I'm having trouble reaching overhead, so I'm talking a lot about balance and getting around. I don't want it to for you to think that it's just limited to that either, right? Because it's important to hey, be able to take those arms up overhead, right? And not everybody can because there's a lot of just chores around the house that you need to be able to do. I was just talking with a patient an hour before I recorded this, right? She's saying like having a lot of issues actually just getting stuff in and out of the cupboard. She said she doesn't want to have to wait for her husband to get home to do that. Like she wants to feel confident and strong that she can just do some of those things without assistance. So remember, it's not just lower extremities we're talking about here. It's the upper extremities, it's the spine, it's really everything. And then there's a lot of also what are called like neurodegenerative conditions, and you'll know the names here like Parkinson's, Alzheimer's, Huntington's, ALS, multiple sclerosis, MS, right? Like all of those things are very, very much long-term issues, right? Like to address and really working on all of the neurological issues associated with them then too. Right. So who is this for? Right. So like I said, that's a list of um, common diagnoses. So if you have any of those, but like I said, that's not by any means an all-encompassing list. Uh, Really, chronic pain of any sort makes the list, right? Chronic pain, chronic injuries, right? So if it is just like prolonged knee pain. If you're like, oh, I'm not really ready for a knee replacement, right? Or maybe you've had knee replacements and still like, no, I know there's more than this. I know I can do something about this. That and do so for an extended period of time. Because one thing I actually didn't touch on before, right, that's very common to see too is when we're treating somebody, even on Medicare maintenance, what we'll do, well, a great example is like somebody goes away for a week or two on vacation, right? And they come back and they're like, Nick, like I'm hurting, right? I do hear that pretty commonly. And they said not that they were necessarily more active, they just realized like, oh, they're not getting that hands-on care from the physical therapy. They're not able to do the same exercises. Maybe they were able to keep up with a couple little things, but they couldn't do it just while away on vacation, right? And they realized like, oh no, but that's actually a good kind of a good thing because you realize like how much of a benefit you are having from it. So remember, maybe you're not making all that progress all the time, but at least seeing like, oh wow, this is keeping me from taking quite a few steps back, right? And as I said before, so other things, and we'll send out a list so you get all these things too, right? But it's like anybody at a risk for falls. Uh, Another big one that's come up recently too is like, Nick, I don't know where to start, right? Some people say, like, I'm not in necessarily a whole lot of pain. Maybe they're in some pain, but they're just very nervous about getting back to exercise, right? They recognize how important that is for the body, right? Maybe it's because they want to prevent any metabolic issues, right? Cardiovascular issues, or breakdown of any more arthritis, anything like that. And maybe they're not really hurting that bad, but they just know they need help getting started, right? And sometimes this will look like now going for several months, right? Because they just don't know what to do, right? Okay, you may be able to make a little progress and say, I need some more help, right? So that's another good way to start, right? Is like kind of a whole body exercise program coming in for that, because now we can help show, hey, proper pushing, proper pulling movements, proper squatting movements, bending movements, twisting movements, and so many other components to that, right? Uh, so again, this is really anybody who wants to stay independent, living at home, avoid any major injuries, any major progressions. Uh, it's it sounds pretty simple because it really is, right? Like it's Medicare really does want you to, and I mean, we want you to, you want to, your family wants you to, just avoid any of these major downfalls with age, right? So, next question that comes up a lot of times is, how often do I come in for Medicare maintenance? The answer is always it depends, right? Uh, most I actually all of my patients on Medicare maintenance are either in 2 or 3 times a week, right? That's going to be usually what it is, right? It's 2 to 3, uh, not going to be less than two because with strength training, with cardiovascular training, like less than twice a week, it's not going to cut it. With less with balance training, like once a week is really not going to help make the progressions that are needed. I shouldn't say, excuse me, progressions, even to be able to maintain levels. Like you're going to see a lot of regression even with that. So, like that minimum spot is usually the 2 times a week. Certainly 3 times a week is very much appropriate and very common to see as well. But usually it just depends on the person. Some people do have trouble recovering from exercise if they're just getting into it. So that is always a concern. It just depends really what your situation is, but between you and your physical therapist, you'll be able to figure that out. So if you want to be able to maintain all of those, really the research has proven that it needs to be at least the twice a week. Uh, Another big question that is really important because a lot of people are on Medicare Advantage plans too. So yes, Medicare maintenance for physical therapy is covered by Medicare. And the Advantage plans are required to cover the exact same things that Medicare does. So under traditional Medicare, right? If you have traditional Medicare, if you have any of the Advantage plans, doesn't matter. You are covered, right? And now speaking of like insurance in general, right? What does Medicare maintenance cost, right? Well, it's whatever you would normally pay for physical therapy, right? Most of our patients don't pay anything to come in for PT, right? As far as like if they're on Medicare, some of the Advantage plans have either copays or co-insurances, and I'm not even going to begin to speculate because they're all over the place. It can be completely different. Some people have deductibles at the new year. Um, but again, it's really like it would be the same thing as if you've ever gone for physical therapy. It's going to be the same thing. Like I said, it's easy enough to call in. We can always verify insurance for you. Uh, but generally, if you have Medicare and a Medicare supplement, because Medicare covers at 80 to 80%, supplement usually covers the other 20%. Generally, there's nothing owed. Like I said, some of the Advantage plans do have copays or co-insurances, but again, this is something you just have to check in on, and it's pretty simple to find out, right? So, how do I start, right? You get a script for Medicare maintenance. It's really that simple. Uh, Now, what happens a lot of times is you don't, if this is for people who are already in physical therapy, uh, generally we would go to that threshold of the 2410 that I said before, and then we could get a script for Medicare maintenance, right? So that's more just semantics on it that you don't have to worry about. That's more just, hey, we have to go through different channels. But if you get a script, like if you're currently going to physical therapy and you want to continue, and your physical therapist said, "Oh yeah, I think it's time we switch over," just have to reach out to the doctor and say, "Hey, and can I get a script for Medicare maintenance?" Never had a doctor that was opposed to it because, again, I think they're very much on board with recognizing the importance of uh, the strength, the balance, the agility, the everything it is, the fall avoidance, the endurance um, for their patients as well. So they want to see you be able to do that. Um, so if you haven't done PT, you would just get a script for physical therapy. That's all to say. PT, eval and treat, doesn't have to be anything special. If you've gotten to the point of plateauing in physical therapy, then you could get this. But either way, if you ever have any questions, right, like always reach out and ask, right? So like that comes down to really my last point here is you have three options, right? Option number one, do nothing, right? Always an option. You don't have to do physical therapy. I'm never going to obviously force anybody to do PT. Some people just say, yeah, you know what? I'll just keep doing what I am doing already as far as exercises. Maybe you're not doing anything, don't want to do anything. That's fine, right? Like that's uh we're all entitled to those choices, right? Another simple option for somebody who's just kind of on the fence is set up a free screen, right, with a physical therapist, which basically is, hey, you know what? My shoulder's hurting me. Can you check it out? And we would have a discussion on that, check everything out, say, hey, what's going on? Uh, Maybe it's, oh, my feet are bothering me and my balance is terrible. Can't walk. Okay, we could look at all of those things, right? Or you can say, hey, I'm ready to sign up for some physical therapy, dive right in, set up the initial evaluation. Because I tell people, like, right, there's your health is not waiting for you. Like, nobody's going to take care of it for you, right? This is something that you're responsible for. And that's why I'm not going to hold your hand to just like get into physical therapy, right? But I'm going to encourage you if you feel it's necessary, if your doctor, if your family feel like it's a good thing, if you're currently in PT and I think you should keep going, I'm going to tell you that because that's my job as a professional, right? Is to evaluate where you're at, what is going on. So hey, right, this is Medicare maintenance kind of in a nutshell, right? It's basically Medicare will cover you as long as you're going to put in the effort uh, to do the exercises, to show up to your PT appointments, because they want you to maintain as robust a health as possible. And I think most individuals want that for themselves. Most people want that for their family members. So please, if you have any questions, feel free reach out to us. More than happy to answer any of that. If not, I mean, set up a free screen, set up an initial evaluation, and we can get on your way. Hopefully getting right back to doing everything that you wanted to and just even maintaining all the levels that you're at. Again, this is Nick Harowski, Robbins Rehabilitation. Thanks again, guys.